My name is Jazrawi. I'm an interventional cardiologist running a private practice in Clawson, Michigan. I wanted to be a doctor since I was a kid in primary school. Half of my relatives are physicians, comes with family physicians back in Iraq and also in the United States. When we came in to the country, me and my parents, I did not speak any English, and so there was a big language barrier there. So I was able to achieve my goals. I was able to finish with good grade, with good GPA from high school, and got accepted in an undergraduate for basic science at McMaster University. And I think that gave me a good moral support that since was able to accomplish that, this will take the handicap away from me in terms of the language barrier or in terms of as a new immigrant into the country. So it made me almost as good as, if not better than my other colleagues who were born and raised in the country. I applied to medical school and I was accepted at Ross University School of Medicine and started my clinical training in the United States, in Michigan, went to New York, also was able to do a few rotations in various parts of the states, like in Washington, D.C. and Ohio. I graduated from internal medicine and then was successfully accepted in cardiology. I did 1 year of heart failure transplant training. I went to University of Utah, where I did part of my training there for about a year. It was a very exciting time for me to go to Utah. The different cultures, different environment, and with a lot of exposure. Through my residency, I had lucky that I met a lot of good people. A lot of my colleagues are a good friend of mine through residency.
He applied to residency at Providence. I was an attending then. And then, of course, he became a colleague, and I've used him throughout the time consulting on my patients. So I've known him for a very, very long time.
I came to know Dr. Jazrawi, I think in 2011, when I was doing my rotation in Providence, Southfield. At that time, he was doing his cardiology fellow, and we met together. I saw him, he's jumping to situations when he tried to help people, and he tried also to be helpful to me.
I actually met Dr. Jazrawi when I was a resident. I was actually second year resident when he became an attending at Providence Hospital in Southfield, and I just basically established a relationship with him that's grown immensely over the past few years.
In 2014, Dr. Jazrawi opened his private practice in Clawson, Michigan.
I think a lot of physicians go to medicine without a mission, and Dr. Jazrawi is one of those physicians who went to medicine with a mission. And I think he embodies that mission very well.
Patient care is the most important thing for me, because these patients could be your own mom and your own father, okay? So and you don't want to have less than perfect service, perfect care for them.
He built his practice up, essentially from nothing. And I mean, he offers excellent care for his patients. He's always available.
He did a lot of things for the community. As I'm saying, you're not gonna find his name in a banner of newspapers or something like that, but you can find his touch among his patients, among the community, and in the support he believed to a different program through CAP and through different organizations.
Very, very kind, very compassionate physician, and really goes above and beyond for his patients.
I'm proud to take care of my Chaldean population, my own family here, and Sometimes you see them there in the office as if they're home. They're comfortable, they're relaxed, which makes me proud of myself, to finally able to open up an office and provide care to this community.
He's one of the people that have this lax, welcoming, and genuinely generous attitude towards the people.
I think Dr. Jazrawi got the Rising Star for so many reasons. First, clearly academically. Like I said earlier, he's been very well-researched physician. He had done multiple research. He has worked to educate our community about wellness, but also about cardiac disease and cardiac prevention. So he has been quite generous, not only with his time, but also financially, which we quite appreciate that.
We are expecting him to keep the good work, keep the good achievement, and we are expecting him also to be a good engine or a good push for the community to go further and further with the new generation of physicians and professionals that will carry this community to the next level, and I think Jazrawi is going to be one of them.